I have also heard that you have treated the likes of Sachin Tendulkar and Sunil Gavaskar. Did you have a fanboy moment when you found out or when you were treating such pro athletes?
A 40-40 rule, maybe 20-20 may be more difficult. So every 40 minutes you need to get up from your chair. Every 40 minutes, if possible, look away from the screen out if you are on your mobile screen or on your computer screen.
Okay.
Recently, I think some few years back, our Prime Minister announced the World Yoga Day.
Yeah.
So people are doing yoga on the World Yoga Day. But the problem is they are doing yoga only on World Yoga Day.
Most overrated piece of advice you keep hearing.
No pain, no gain.
Okay. Worst thing you can do after a sports injury.
Continue playing.
Cocktail Studio presents The Health Relay, a podcast initiative by Somaa Health. I am Sanya Thosar, your host and the co-founder of Somaa Health. In this series, we speak to experts who are shaping the future of healthcare in India. My guest today has almost 2 decades of experience at the intersection of brain science and physical recovery. He has trained across 3 continents and worked at several well-renowned institutions in Bombay, like the Preach Candy Hospital, the Lilavati Hospital, and now runs one of the most advanced neurorehab centers in Mumbai. Let's welcome Dr. Gaurish Kenkre. Hi, Dr. Kenkre. Thank you so much for coming on the Health Relay. I'm directly going to dive into your subject today. Your uncle runs the Kenkre Football Club, which is one of Mumbai's most iconic football academies. At what point did you think, I don't want to play the sport, but I want to fix the people who do?
So yes, my uncle do run a very famous football club, Kenkre Football Academy.
Yeah.
But very few people know that I also used to play professional sport, but it was not football, but it was cricket.
Right.
So I used to play cricket, and that's where I started realizing that injuries and getting prone to injuries is very common in sports, and where I started reading about rehab and physiotherapy, and where I started entering in this field. Because initially I always wanted to be a doctor. Then my uncle guided me to be a physiotherapist.
Okay, interesting. But then what made you leave the sport?
In my times when we used to play, there was no IPL. So making a career in sport was very, very difficult.
Yeah.
So if there was an option, I would have definitely continued with the sport. But at that time, it was very difficult to make a career. So we had to find an alternative where you can keep playing the sport, but by going in some other manner. So this was the best idea to enter into something where I'm connected to the sport, but doing something else.
Interesting, very interesting. Since you spoke about you yourself playing cricket at some point in your life, I have also heard that you have treated the likes of Sachin Tendulkar and Sunil Gavaskar. Did you have a fanboy moment when you found out or when you were treating such pro athletes?
So when we were doing physiotherapy, or when I had passed out, the actual dream was only to meet Sachin Tendulkar or Sunil Gavaskar. And when I actually happened to meet them, it was like, so means I've achieved what I wanted. So it was like that. So absolutely fanboy moment and most satisfying day of my life, I feel. Means. So I'd actually posted on my Insta also that what I wanted to achieve.
Oh, that's amazing. Your dream coming true.
It was like a dream coming true, because as a kid who plays cricket, means in 90s and early 2000, I think meeting Sachin Tendulkar or Sunil Gavaskar is like...
It is a dream.
Yeah.
And that finally came true.
Absolutely.
What's the biggest misconception people have about a physiotherapist, about what a physiotherapist actually does?
The most common misconception is massage. So most of the people correlate physiotherapy to massage, or basic exercises, like people consider yoga and physiotherapy together. So that's misconception, because physiotherapy is a much more advanced science over just exercising or just massaging.
Right.
There is a concept where we know the mechanics of the body, where you falter, how can you correct those mechanical faults. So there is a big scientific study and evidence over it. And that's where I think everybody should know that a well-trained professional physiotherapist can guide you much better than just a regular exercise form.
Right. Since you spoke about massages, what's the difference between, say, a physiotherapist and a chiropractor?
So, a well-trained chiropractor definitely is a very good evolved science like physiotherapy. But if you see in India, there are people who are doing or practicing chiropractic just by doing a 2-day or 3-day courses. So
Right.
just breaking neck or coming on Instagram by showing those tuck sounds is not chiropractic. It is all proper 4.5 years course, which is more in US, which is chiropractic. What is the difference is physiotherapy. What we train is how a person can get independent as soon as possible.
Right.
So we don't try and make them dependent on our things unless they absolutely need it. So we train them the exercises, we teach them, and they can do those exercises at home and they can just follow up with us on the phone. In chiropractic, you slightly get dependent because you have to do those maneuvers every day, go to the therapist, and slightly more professional dependent feel.
Right. When do you think someone should come visit a therapist, and how should they choose a physiotherapist?
Again, a very good question. So you have to listen to your body. That's very important.
Yeah.
So one of the main things what happens or when your body is telling you is pain. So pain is the first guarding mechanism of your body. So when there is pain, many of us just overlook the pain a lot of times.
Yeah.
Like regular back pain and neck pain is so common that
Correct.
each one, even I have or you have.
Yeah.
So that pain again is not a big problem. But if this pain stays for a long time, then you need to either consult a physiotherapist or a orthopedic doctor who can guide you through. Also, the intensity of pain is very important. So if I ask you on a scale of 10, if your pain is just 1 or 2, then that can be just a niggle which can settle over time. But if the intensity of pain is much higher, like more than 6 and not settling, then that needs professional guidance. So that is the time I think you should either visit a physiotherapist or a professional trained doctor who can guide you through the process, what you need to do.
Right. And how do you choose one?
So again, coming back to old times, we always used to go to our physicians.
Yeah.
So every small problem used to reach out for the physician.
Good.
Now what we do, chest problem, you go to a chest specialist.
Yeah.
Knee problem, you go to a knee doctor. Shoulder problem, you have shoulder specialist. Similarly, in physiotherapy also, there are these super specialties which have come.
Okay.
So a neurological problem, there is a neurophysiotherapist who is available. A sports-related problem, sports injury, there are sports physiotherapists. Patients having difficulty in breathing, there are cardiovascular physiotherapists. So actually, if you go deep into it, then you can choose your physiotherapist depending on your problem. But most of them are aware in general about what problems you have. So a regular neurophysiotherapist may be able to guide you with some musculoskeletal injury also.
Right.
But you need super specialty in case of advanced problems. So
Right.
the therapist will only guide you to other specialties if it's required.
Correct. What will help me decide whether I need to see a physiotherapist or an orthopedic?
The orthopedic field, there is no orthophysician as such. So actually the physiotherapist plays a role of that physician. So in fact, with your smaller injuries or some strains, aches and pains, you can reach out to your physiotherapist. If they clinically assess and if they feel that there is something majorly wrong, then they can either guide you to do some investigations and then reach out to the orthopedic, or directly reach out to the orthopedic and the orthopedic can guide you to do the investigations.
Right. I think a lot of times it's also easier to access a physiotherapist than an orthopedic doctor, which is why I think people prefer more to go to a physiotherapist. I think the other reason is also that a lot of times people are also scared to go to a doctor, which also may lead them to maybe going to a physiotherapist, you think?
So other thing what I feel is the bonding. So when you go to a orthopedic, you meet them, it's only a talk of 10 minutes or 15 minutes and then they prescribe medicines and then you go. Once you visit a physiotherapist, it's not a one-day job.
Yeah.
You end up going to them maybe for a week or 15 days, or then you keep following up with them. So the bond which you develop with the physio is much closer than what you develop with a doctor.
Correct. I think I'm going to come to people, talk a little bit more about people of our age. If you could give one piece of advice to people who are in their 30s to protect their body for the next 30 years, what would that advice be?
So, younger individuals nowadays, we are always sitting. So the physical activity levels have completely gone down.
Yeah.
So the ideal advice what I give is try and follow a 20-20 rule or a 40-40 rule. Maybe 20-20 may be more difficult. So every 40 minutes, you need to get up from your chair.
Mm-hmm.
Every 40 minutes, if possible, look away from the screen, or if you are on your mobile screen or on your computer screen.
Okay.
And if possible, every 40 minutes, do some activity of your upper limb or shoulder where you stretch out slightly. Okay. So that you come out of that static postures, because the evidence says that the static postures are much more harmful and much more loading effect on your body than the mobility effects.
Right. I think that's great advice. And I know for a fact that a lot of people don't follow it also, because it's so difficult to remember at every 40-minute interval to be getting up and, engaging in some kind of stretches. Right. But that's something that everyone should, I think, definitely remember, is to follow the 40-40-40 rule.
Also, there are so many applications which are available nowadays. There are apps where you get reminders and everything. So these things are coming up. So I think in future, app dependent, and we will start doing that.
Yeah, absolutely. We are seeing a big rise in recreational athletes in India, people who are playing pickle, paddle, running marathons. Do you think they are training smart, or are they putting themselves at risk of injury?
So there are two kinds of people. One is who are actually regularly playing the sport or regularly engaging in some form of physical activity. Mm-hmm. And there are some people who are their friends who, looking at them, start playing pickleball and everything.
Right.
So these are the people who are prone to injuries because they are not doing something smart, but they are just looking at the other person, and because he's doing, they are getting into that.
Right.
So we have so many injuries coming of pickleball, paddle. The newer the sport, new injuries are coming in place. So
right.
Yes.
I think for somebody who's active, suddenly getting into a new sport is also not always, you shouldn't go all out. Like, I remember I came to you after playing paddle the first time where my elbow was hurting, and I work out, but that's not a muscle that I had been using very actively.
Absolutely. So somebody was mentioning, somebody who was playing tennis, one of my patients, he went to play pickle, and with the same force of tennis, and the friction in the court was so much that fell on his nose. Oh, so depending on which sport you're playing, again, it doesn't translate into the other sport. So you need to be a bit careful. And as you rightly said, every sport has different muscle use, and we need to be careful about that, of what you're doing. A lot of injuries from the sport and a lot of injuries from yoga. So recently, I think some few years back, our Prime Minister announced the World Yoga Day. Yeah. So people are doing yoga on the World Yoga Day, but the problem is they are doing yoga only on World Yoga Day. So the next day, I think we need to celebrate World Physiotherapy Day, because everybody comes with injuries. Suddenly was not stretched the whole life. People are pushing them completely, trying to make them touch the toes. Absolutely rubbish things happens, and they come with so many injuries.
Absolutely. There's a huge debate about pushing through pain in sport. Where do you think one should draw the line?
So, as I mentioned earlier, pain may be just a guarding mechanism of a small needle, and the body is trying to give you a message that there is something wrong. So many times that pain can subside over a period of 2 or 3 days. So two things are important: intensity of pain and how much time the pain is staying in your body. So if the pain is staying in the body for a longer time and with a strong intensity, you need to approach a professional in that case.
Right, and not continue playing the sport.
Fortunately, you need to stop.
What does return to play mean?
So return to play is, many times what happens is the athletes are in a rush to resume play because they have a short career and they want to play maximum. But they need to understand that if that injury recurs, then the healing takes much more time.
Yeah.
So we, in our assessments, we have few outcome measures. So there are very specific outcome measures, whether the knee is ready, whether the hip is ready, or whether your spine is ready, depending on the injury. And those scoring has to tick all the boxes. Once those boxes are ticked, the physiotherapist will tell the coach that he is ready for returning to play.
How do you think people who are into recreational activities can prevent injuries? Like, what's that one 10-minute hack that people can do daily to prevent injuries?
So many times, again, because you are into competitive sports, you like to play the sport itself. But having a good warm-up or build-up to the sport is very, very important. So our body muscles need some good warmth to fire properly. So having good warm-up activities like small maneuvers or light stretching is something what you need to do before you start the sport.
How important is recovery time after playing a sport to avoid injury?
So when you are playing a sport, the sport is normally very intense and there is a lot of fatigability which happens in the muscles because your muscles or the limbs don't get that rest period and the muscles have to continuously fire and they get tired. You must have heard about lactic acid generation in the muscles. So all these things are something which are going to make you sore. And when you are sore, the muscle is in a state of contraction. When it's in a state of contraction and suddenly you need to do sporting activity or a intense activity, the muscle can get pulled and you can get injured. So yes, so you need to give good amount of time, good amount of hydration, good amount of rest, and possibly good amount of, we call it fermentation, like icing, which will help you to prevent injury and continue with your sport for a very long period of time.
I think that's where we see a lot of athletes doing things like cryotherapy and all that now.
Going into those ice bath and everything.
Yeah.
So that's, people call it fashion, but it is also helping them recover.
Since you are an expert on neurophysiotherapist, I'm directly going to dive into neurorehab now. There's a growing incidence of stroke. And when a person suffers a stroke, there's a golden period after suffering a stroke. Can you maybe explain what that golden period is?
We call it neuroplasticity. So there is something called as neuroplasticity in neurological rehabilitation, where we have heard that the brain cells don't recover. But the research says that that function of those brain cells which are dead is taken by the surrounding area. So that surrounding area, to take over that function, it has to be very early during the phase of or post the phase of that incident. So the neuroplasticity research says that is very, very fast or strong in the first 3 to 6 months and continues till 1 year post-stroke. But it doesn't mean that it completely ends. Later, after 1 year also, the recovery can happen. But the patients build up on some compensatory strategies where then they don't use the limb which is affected. And then breaking those strategies are very difficult. So in our therapy programs, what we say is unlearning something is more difficult than learning new thing.
Yeah.
So that's why treating it early so that the patient don't learn the wrong movements, because unlearning the wrong movements would be difficult.
What is that critical time period?
Yeah.
So it's a one
For
one year.
rehab, it's around 6 months to 1 year.
Okay.
But the golden window of treatment, medical treatment, is in the first 3 hours or first 6 hours of the incident.
Neurorehab is something which people encounter when there's some devastating episode. In plain, simple language, what is neurorehab?
As you rightly said, most of the people are not aware because it's only when the incident happens.
Correct.
So what happens with these people are suddenly a walking person comes on a wheelchair or is bedridden.
Yeah.
So first of all, it's like a big jhatka to them that what has happened.
Yeah.
Not only to the patient, but to the family also. And for a therapist to take them out of that, because there is no magic in neurorehab. It's going to take time and it's a journey what the patient and the patient's relative has to go through.
Right.
So in short, if I want to answer it very shortly, the neurorehab is how a therapist is able to counsel the patient and the patient's relative about the journey, what they are going to go through, the treatment techniques, what they have to possibly apply on the patient, and how the caregiver is going to be an integral part of that journey, because it's not just about walking or doing anything. It's about getting independent or having your own dignities.
Okay, so that's basically an overview of what neurorehab is. Okay. How do you think robotics plays a role in neurorehab?
As I mentioned, that repetitions, when you're doing just a movement, doing around 900,000 repetitions may be very boring for a patient to do. But with robotics, what happens is those same repetitions are game-based. So you are actually playing game and not realizing that you are ending up doing those repetitions.
Right.
And in robotics, the other important thing is, as you are doing it every day, you can measure outcomes. So objectively, you can measure what you are achieving or what is the improvement happening. So neurorehab is no magic, but it's about time and lot of hard work from the patients, which helps them to recover.
One of the differentiating factors in your clinic is having aquatherapy available and having a pool with an aquatherapist available for treatment for patients. Can you explain what aquatherapy is?
So when we started having this idea about a center of neurological rehab, we wanted to have everything which will benefit the patients, and that's why adding aquatherapy was one of the part of the clinic setup. Aquatherapy definitely is one of the most advanced form of rehab which has come into practice. It's been there for a long time, but now the awareness is increasing. So as you enter the water, your gravity is gone and your weight is taken off. Buoyancy effect, everybody knows.
Yeah.
So because of the buoyancy effect, you are lighter and your limbs can move much more easier.
Right.
So if you ask me about neuro patients, what problems you have weakness. So the movement is limited or movement is not happening. With the buoyancy effect, you can make that movement easier.
Okay.
Also, when we talk about neurological patients, we just talk about the physical movements. That's your motor power, we call it. But we also have sensory nerves in our body. So sensation is something which in space, there is no sensation if I'm moving like this. But same way, if I'm moving my hand in water, there's a constant sensation which the water is giving. So the aquatherapy can also help to train your sensory systems or the sensory nerves, which are also affected in neurological patients.
Right.
And the other important thing in aqua is it's not only neurology, but patients who have knee pain, foot pain, hip pain, mainly old age degenerative pains. These patients, most of the problem for that pain is loading because of their weight, because of less muscle strength. So when you are in pain, you cannot strengthen because strengthening is like you putting weight on the foot and then doing movements.
Yeah.
That's going to increase the load and that's going to increase your pain. Water you enter, your load is less. You can do the same aggressive exercises because the loading is minimal.
Okay. One question just out of curiosity. If I'm somebody who doesn't know how to swim and I'm scared of water, can I still go for aquatherapy?
So that's from patient point of view.
Yeah.
But me as therapist, I also don't know swimming, but I take aqua sessions. So yeah, because the pool depth is much lower, so you can definitely enter the pool and do exercises much more effectively.
Is aquatherapy still very niche in India, or is it becoming more accessible?
So in cities like Mumbai, the awareness is much higher and a lot of centers are coming up. But other parts of India, it's still very niche. Awareness is not there. Benefits are, people are not aware about the benefits. But saying that, we have started Aquatherapy Center in one of the most rural part of Maharashtra called Gadchiroli, and running it very effectively. There are around 7 to 8 patients every day. With waiting appointments of 5 days or 10 days.
Okay, so we are coming to the last segment of the podcast, which is the rapid fire. And I want very quick answers to the questions that I'm going to ask you. First question, stretching before or after a workout?
After.
Okay, just after?
तू करती है ना?
मैं दोनों करती हूँ, before and after. Ice packs or hot packs?
I prefer ice packs, but normally what I say is before exercise hot, after exercise cold.
Foam roller, essential or overrated?
Useful, but no magic.
Okay, next one. Most overrated piece of advice you keep hearing?
No pain, no gain.
Okay. One exercise every human being should be doing?
So this I will answer slightly more detailed. We speak about strength. Everybody works out in the gym and work on the strength, but very few do stability. So one exercise which I would advise is standing on one leg for 30 to 40 seconds every day.
Very interesting. Does a cracking sound during movement mean something is wrong, or is it just scary?
So nothing is wrong, but it's very important for a chiropractor.
Worst thing you can do after a sports injury?
Continue playing.
Football or cricket? Which sport is harder on the body?
So every sport has different demands. So you cannot speak about the harder this thing, but intensity wise, football is much more intense.
What is the one habit that you'd like to change in every Indian?
Don't wait for pain to take care of your own body.
So who's your favorite cricketer?
Now I will have to say my daughter. She plays cricket.
Oh, wow. So cricket runs in the family.
Yeah, absolutely. So I think my dreams are going there.
Nice. Thank you so much for coming on the Health Relay.